We have a lateral view of the tibia and fibula on the right side of the body, and we're going to review the prominent bony landmarks. First, for context, proximal is up here, distal is down here, anterior is to our right, and posterior is to our left. The tibia and fibula are the two bones of the leg, lower leg in lay terms. The tibia is the larger, more medial bone, and the fibula is the smaller, more lateral bone of the two. We'll begin with the landmarks of the tibia. Because this is a lateral view, we can clearly see the lateral condyle of the tibia here. If we look back here, we can see peeking out a bit posteriorly part of the medial condyle of the tibia. Here is the intercondylar eminence right here. Along here, we can see the tibial tuberosity, which is the distal attachment for the quadriceps femoris musculature. Here on the proximal, lateral, anterior tibia, we have Gerdy's tubercle, which is the distal attachment for the iliotibial band. The shaft, or we can say body of the tibia, comes down distally. And because we are looking at a lateral view, we can see here the lateral border, or as it's usually termed, the interosseous border of the tibia. It's named the interosseous border because the interosseous membrane, a fibrous membrane that unites the tibia and fibula together, attaches there. Down here, we can see the medial malleolus of the tibia. Now turning our attention to the fibula. Proximally, we have the head of the fibula here. This is the neck of the fibula here, and then we can see the shaft or body of the fibula going down distally. Regarding muscular attachments onto the fibula, the biceps femoris of the hamstring group attaches onto the head of the fibula. The Fibularis longus muscle attaches to the proximal half of the lateral shaft of the fibula, and the Fibularis brevis attaches to the distal half of the lateral shaft of the fibula. Looking down distally, we can see the lateral malleolus of the fibula here. With this lateral view, we can nicely visualize how the lateral malleolus of the fibula projects more distally than the medial malleolus of the tibia. So this has been a review of the prominent bony landmarks of the tibia and fibula on the right side of the body with a lateral view. Now that we've reviewed all of the prominent bony landmarks here, let's quiz ourselves. Pause the screen for a moment and see how many of the landmarks you can name. And now, if you would like, pause the screen again and see how many of the attachment sites you can name.